Dr. Burke, it's amazing what we've seen here. Does it work for other ailments and chronic pain issues as well?
Yeah, it does. It works for fatigue or feelings of stress. Like a lot of times people are walking around, their whole body is just filled with stress, and they can't sleep at night because they're laying there going, okay, you know, what's going on with you? So basically it works for improving energy levels, stress responses, and also...
Is this why a body massage makes people feel better sometimes when they've been stressed out?
Yeah, because it releases that built-up energy. And so this is very specific to different parts of the body and different things. So it works on a lot of different things.
What about things like fibromyalgia, which I know a lot of people suffer from?
Fibromyalgia is a similar problem, but it's gone on a long time. It's more of a chronic problem where the person has tenderness all over their muscles. Their muscles are swollen and tender from head to toe. And so I did a lecture at a fibromyalgia support group. I kind of dismantled the group because I started working in everyone, and it works great on fibromyalgia. And it has to do with multiple areas of blockages, not just one. So it's kind of more of a chronic thing that's spread through the whole body.
And that's because they experience pain all over,
all
right? It's not one day it's here, another day it's somewhere else. It moves, basically.
Yeah, and that pain that's charged, and it's draining their energy. It's like their battery is low all the time, so they get tired all the time. They have sleeping issues. They get depressed. And honestly, some people try to sleep at night, but they can't because they're in pain. So when you remove this pain, they get into deeper sleep. And I've had people tell me, well, I'm depressed, and that's why I can't sleep. But I don't think that's true. I think they can't sleep, so then they're depressed. I mean, if you don't sleep well, you're going to be depressed. I mean, especially over the years. I mean, I've had people that haven't slept for years and years and years, so and they feel depressed.
It's kind of a vicious circle, basically.
Yeah.
What are some other areas? Maybe give us some examples of people that have had various different types of chronic pain that you've been able to help.
I have a couple very interesting ones. Like one lady, she went to the dentist and she had this thing in her mouth, and they took an X-ray, a rotational X-ray around her mouth. And she was at one of my seminars, sitting in the back, and the little plate got caught in her mouth and pulled the jaw out of place. And ever since that, for 8 months, she couldn't open her mouth. So she couldn't eat. She lost a lot of weight, though. So I checked her, and the problem was not in her jaw. It was in another place in her body, another acupressure point. I stimulated that, and I stood back, and I just saw like little tears coming down because she gets so much relief. She was able to open her mouth for the first time.
That right then and there. This
Yeah.
wasn't something she experienced when she got home. You pushed the point, and basically her jaw was able to open.
Yeah, the nice part about this is that you see results right away. And the reason you do is because you're getting to the right source. You're not treating something that is secondary. You're getting primary areas of blockages. Had another case, this guy had back pain for about 45 years. He's actually a neighbor. And he couldn't even bend down. Very skeptical. So I brought him up and I did the demonstration on him, and because it works really good for back pain and disc problems. So he said, oh, well, I'll give it a shot. You know, so I do the treatment, and he kind of looked at me like in shock. He was like, how did you do that? I almost upset him because here's a guy that went all over the place. He'd been to the best doctors. He spent thousands of dollars. I come in there in a couple of minutes and I do the treatment. It was just too much for him. He just felt like he was made wrong. And I said, okay, well, let me put it back.
Which I'm sure he didn't take you up on.
Right, he says, no, that's fine. He goes, thank you, I appreciate it.
Well, that's a good example, though. I mean, how long should somebody wait before they do try this? I mean, at what point do you say, you know what, the medicine I'm taking doesn't seem to be working. I've put up with it as long, you know, I've tried to wait it out and it's not working. At what point do you say this is when you ought to come in?
Well, typically people tend to wait. In my clinic, they wait until they've tried everything else and they end up in my clinic. It would be easier if they came a little bit sooner, because as soon as that injury starts, the sooner you can get to it, the faster you can get results. Because it works on acute injuries as well. It just allows the body to heal. Well,
and that was one thing I was going to ask you, too, as far as chronic pain goes. I mean, is it in the long term, is it damaging to the body to allow chronic pain to continue?
Absolutely, because the body is not healing and you have this inflammation that just pools and swells, and then the cartilage starts to degenerate over time. And I found typically with working with thousands of patients that if given the choice, they would prefer not, they're just tired of taking all the pills. You know, if they can take less medication, they would like to do that. And plus, medication's expensive. And having a problem, too, sucks up all your time. You know, I mean, I personally don't have more than 3 days to be in pain. you know. So if I have a problem, I'm going to go handle it. I mean, I'm a busy...
Well, some pain is so debilitating. People, headaches, people are in bed for 2 days. And not necessarily just, I mean, can this deal with migraines and those types of things as well?
It's totally unnecessary for these people to go on and on and on with this pain, chronic pain. And what's happening is, when you evaluate it, if you only look at this little portion of the pain, and you miss the other parts of the body, you're going to miss it. So there is absolutely a way to get to the root of it and handle these, but you have to evaluate the person. You have to find out what's going on as compared to just jump right in and treat it, you know?
Speaking of evaluation, how do people go about finding out more about this and how to get an evaluation and actually maybe get their be on their way to getting out of this problem and getting rid of their chronic pain?
Yeah, they can call. They can just come in. Just give us a call. We'll do a consultation. Let us sit down and listen to your problems. Let's get to the root of it. And we can do an evaluation, find out exactly what's holding this pain in place and keeping it stuck in the body. It's totally not necessary to have this problem in there for a long period of time.
And how long does an evaluation like this take?
It takes an hour.
1 hour, and basically you're checked from head to toe, and there's a good chance you're going to find out this is what's been causing this, or maybe this is what's been causing it, and here's how we go about fixing it.
Yes, absolutely.
Are these things that people have to keep coming back for and doing long term, or is it sometimes a one-stop fix? And we saw some here where just one treatment people seemed well.
Yeah. Well, here's the thing. The pain's going to go away first, okay? But the actual problem might take a little longer to stabilize, so then it doesn't come back. And the nice part about this, and why people like this technique, is you get immediate relief without the medication, the surgery. However, it does take some time to stabilize it, especially if it's in the chronic phase. I mean, you take a guy with 45 years of pain, it's going to take a couple months of work to stabilize him to the point where it's staying there. But once you get it stabilized, I've never had to repeat the treatment once it's corrected. So it does give you long-term benefits.
Of all the people that you've treated, is there one favorite story that you have, one favorite example that you have of somebody who had just really been suffering and came in and you were able to really provide relief?
Well, I had one lady with a very rare problem. She had tongue pain, right? I didn't know there was a whole network of people on the internet with tongue pain, like all over the place. In England, and they talk to each other, and she says, I have this certain disorder. They were giving her high dosage medication cocktails to numb the pain, right? It was deep inside her body. And you can imagine everyone was promising, we can help you, and then we can help you. And then they didn't help her. And she came in extremely skeptical, and I said, I already knew in my mind I could actually help her, but I couldn't tell her that because she wouldn't believe me. So I said, well, let's just see if we can make it a little more comfortable for you. So I checked her, and we found an area not even related to her tongue. It was down here in her organ points. It was an acupressure point. And we did the treatment. It knocked out like 80% of the pain, just like right there, within a couple of minutes.
Wow.
And she's like, she still couldn't believe it. She's like, well, it's probably going to come back, you know. So she comes back, and we keep working on her, and she just couldn't believe it. She was amazed. So that was a really big benefit, because here's a person that's tried everything, and we actually found out her pain wasn't coming from here. It's coming from someplace else. So.
And that's true, as you said, of so many things, with knee injury, back pain, head pain, tongue in this case. I mean, really across the board, so many people with a lot of different problems can get help.
You've watched these testimonials and heard from people who have experienced the body restoration technique. You owe it to yourself to find out more. Attend this free seminar in your area. Remember, chronic pain is not normal, and you don't have to live with it. Call now to reserve your seat for this free seminar.